Handi stands for Healthcare Apps Network for Development and Innovation, but really it picks up on the German word for portable phone, so Handi. So Handi Health is a not-for-profit community interest company which has run a number of events bringing together various people with some good deep domain knowledge, either because they're technical or they're clinical or they're interested in mental health or patient engagement or whatever it is, and getting people to kick around this apps paradigm. And we think of an app as some code that does one thing and does it really well and plays nicely with others. And seemingly the national programme has not got one thing that does it really well and it doesn't play nicely with others. So we're interested in helping people understand whether or not they need an app. Must you develop something for an Android phone, or do you really just need a good web page to gather some data and be able to have that sort of interoperability to be able to share that data more widely? And then tackling more thorny questions, well, what do we mean by interoperability? So there's being able to get a message from point to point, which is perhaps an interface, and then is that message understood? So interoperability. And then in terms of clinical stuff, you've got then how do I get it from my Cerner system to an EMIS practice database and then out to a 111 service? How do I maintain that chain of semantic interoperability through those various systems, through those apps? So Handi has run 4 workshops, we've had 500 people through the doors, and we've just been kicking these ideas around. We run a tweet chat once a week, we've got a web forum, and we just keep on sharing our ideas and our knowledge and trying to set people up so they can carry on developing things. Public sector projects for a long time have had that big, cascadey, waterfall, management-heavy approach to things. Thanks to the Print2 methodology, it doesn't matter if you deliver nothing at the end of it, as long as you've got a great big bundle of documents to prove that you made all the decisions in the right way. We spent all the money, we haven't got anything, we've got a great library of stuff that no one can look at. And what we're trying to do through Handi and events like the NHS Hack Day that Carl and Ross organise, that it highlights the art of the possible. If you were to just say, okay, well, we do need to manage risk, we have got a controlled environment, but we also need to have fun and play and see what we can do. Because otherwise we won't work out precisely what the problems are. Getting people to stand up and say this is the problem at the beginning of this day was great, and then we can get a whole bunch of people together and say, well, I can help you solve that with a tech, or actually stop solving that problem because this person here has already solved it and they've got some open source code and they'll give it to you.